Good evening, everyone. Vanakkam. Thank you so much for joining with us today. The topic managing diabetes. Yes, it is a very sensitive topic as well. So we have Surya again with us to get you through the managing of diabetes. Surya, very good evening.
Good evening, sir.
Yes, Surya. Thank you so much for joining with us, Surya.
So kind of you, sir.
So we can start the
Can we
session now.
start this session, sir?
Yes.
Yes, sir. Yes, sir. Thank you, sir. Yeah, happy evening, folks. This is Surya from Thago Medical College. I'd like to throw up some ideas about diabetes mellitus. And yeah. Now, what is diabetes? Diabetes, to be more precise, diabetes mellitus. What is diabetes mellitus? Diabetes mellitus refers to a group of diseases that affect how our body uses blood sugar. That is, to be more precise, glucose. Glucose being very vital to our health because it is an important source of energy for the cells that make up our muscles and tissues. It's also our brain's main source of fuel. On the other hand, the underlying causes of diabetes varies from by type, but no matter what type of diabetes we have, it can lead to excess sugar in the blood. Too much sugar in the blood can lead to serious health problems. Chronic diabetes conditions include type 1 diabetes and type 2 diabetes. Potentially reversible diabetes conditions include pre-diabetes, where your blood sugar levels are higher than normal but not high enough to be classified as diabetes. And on the other hand, the gestational diabetes, which occurs during pregnancy but may resolve after the baby is delivered. Now, coming to what could be the symptoms of diabetes? Diabetes symptoms vary depending on how much blood sugar is elevated. Some people, especially those with pre-diabetes or type 2 diabetes, may not experience symptoms initially. In type 1 diabetes, symptoms tend to come on quickly and be more severe. Some of the signs and symptoms of type 1 and type 2 diabetes are the polyphagy, the increased thirst, frequent urination, and extreme hunger. In other terms, it can be termed as polyuria, polyphagia, and polydipsia. And unexpected weight loss could be more prominent. On the other hand, a presence of ketone bodies in the urine. Ketone bodies are nothing but the byproduct of the breakdown of muscle and fat that happens when there is not enough available of insulin. Fatigue, irritability, blurred vision, slow healing sores, frequent infections such as gums or skin infections and vaginal infections too. Type 1 diabetes can develop at any age, though it often appears during childhood or adolescence. Type 2 diabetes, the more common type, can develop at any age, though it is more common in people older than 40 years. And when to see a doctor? If you suspect your child or you may have diabetes, if you notice any possible diabetes symptoms, as I mentioned earlier, contact your doctor. The earlier the condition is diagnosed, the sooner the treatment can begin. On the other hand, if you have already been diagnosed with diabetes, after you receive your diagnosis, you'll need close medical follow-up until the blood sugar levels are stabilized. On the other hand, how does insulin works? Prior to that, what could be to understand the causes of diabetes, first of all, we must understand how glucose is normally processed in the body. For that, let's talk about how the insulin works. Insulin it's just a hormone that comes from a gland situated behind and below the stomach, the pancreas. That's the pancreas. In Tamil, it is called as kanayam. And the pancreas secretes insulin into the bloodstream, the insulin circulates, enabling the blood sugar to enter into the cells. Insulin lowers the amount of sugar in the bloodstream. As the blood sugar level drops, so does the secretion of the insulin from the pancreas to decreases. Now, you could see in the slide where the insulin acts as a key, and the carrier, to be more precise, the key for the lock, where glucose, blood sugar, and to be more precise, the glucose is being transmitted into the cells. Yeah, now coming to what is the role of glucose? Glucose, a sugar, is a source of energy for the cells that make up muscles and other tissues. Glucose comes from two major sources, food and from our liver. Sugar is absorbed into the bloodstream where it enters cells with the help of insulin. Our liver stores and makes glucose. On the other hand, when the glucose levels are low, such as when we haven't eaten in a while, the liver breaks down the stored form of glucose, that is termed as glycogen, into glucose once again. That is, uh, when excess of glucose is taken up by the liver and stored as glycogen, when there is depletion of glucose in the blood circulation, the stored glycogen from the liver is being broken down into glucose to maintain a normal range of circulation of blood sugar. Now, coming to what is abnormal and normal levels of blood sugar, you could see the slide, the normal pre-diabetic and the diabetic levels of blood sugar at the fasting and after having a meal and after 3 hours of eating. Now, coming to the concept of what causes diabetes, that is, what causes type 1 diabetes. First of all, what is type 1 diabetes? Type 1 diabetes starts early in the life, as I mentioned earlier, and results from the total lack or decreased production of insulin from the beta cells of the pancreas. That is, the type of cells, beta cells are nothing but the type of cells that are present in the pancreas that secrete insulin. Now, coming to the causes of type 1 diabetes, the exact causes obviously unknown, and that could be the that could be the body's immune system that causes that, which normally fights harmful bacteria or viruses, attacks and destroys our insulin producing cells, that is the beta cells in the pancreas. This leaves with little or no insulin. Instead of being transported into the cells, sugar builds up in the bloodstream, as there is lack of insulin secretion. Type 1 is thought to be caused by a combination of genetic susceptibility and environmental factors, though exactly what those factors are still unclear. Weight is not believed to be a factor in type 1 diabetes. Now, coming to type 2, the causes of pre-diabetes and type 2 diabetes. In pre-diabetes, which can lead to type 2 diabetes, and in type 2 diabetes, our cells become resistant to the action of insulin, and our pancreas is unable to make enough insulin to overcome the resistance. Instead of moving into our cells where it's needed for energy, sugar builds up in the bloodstream itself. Exactly why this happens is uncertain, although it's believed that the genetic and environmental factors play a key role in development of type 2 diabetes too. Being overweight is strongly linked to the development of type 2 diabetes, but not everyone with type 2 diabetes is overweight, right? Now, coming to something called as gestational, causes of gestational diabetes. Now, during pregnancy, the placenta is nothing but the layer of connective tissue which provides nutrition to the baby in the uterus, and it acts as a barrier between the mother and the child. And now, during pregnancy, the placenta produces hormones to sustain the pregnancy. These hormones makes our cells more resistant to insulin. Normally, our pancreas responds by producing enough extra insulin to overcome this resistance. But sometimes our pancreas can't keep up. When this happens, too little glucose gets into our cells and too much stays in our blood, resulting in the so-called gestational diabetes. Now coming to the risk factors of diabetes. Risk factors of diabetes actually depend upon the type of the diabetes. Now let's talk about the, first of all, let's talk about the risk factors of type 1 diabetes. Although the exact cause of the type 1 diabetes is unknown, as I mentioned earlier, factors that may signal an increased risk include the family history, the environmental factors, the presence of damaging immune system cells, that's called as the autoantibodies, and the geography. Now, coming to the family history, if there is a risk of there is a risk of the siblings getting type 1 diabetes if the parent has got diabetes. On the other hand, circumstances such as exposure to the viral illness likely to play some role in the type 1 diabetes in case of environmental factors. Then sometimes family members of the people with type 1 diabetes are tested for the presence of diabetes autoantibodies, the so-called immune system which is attacking the same body. You have, I mean, if the body has these autoantibodies, the body has the increased risk of developing type 1 diabetes, but not everyone who has these antibodies develop diabetes. And in case of the geographical cover, certain countries such as Finland and Sweden have higher risk rates of type 1 diabetes. India being being a developed country, it is making its space towards the geographical concern too. On the other hand, now coming to risk factors for pre-diabetes and type 2 diabetes. Actually, it's to be more clear, researchers don't fully understand why some people develop pre-diabetes and type 2 diabetes and others, and why others don't. It's clear that certain factors increase the risk. However, including uh, weight, inactivity, the family history, race, age, the gestational diabetes, and so on. Now, coming to the weight, the more fatty tissue you have, the more resistant your cells become to the insulin. And on the other hand, the less active you are, the greater your risk. Physical activity helps you to control your body weight. Uses of glucose as energy makes our cells more sensitive to insulin. Now coming to family history, the risk of, as I mentioned earlier in the uh, above slides, the risk increases if a parent or a sibling has type 2 diabetes, and the twins have greater possibility of, if a sibling has a possibility of, I mean, if a sibling is diabetic and the other one has a equal possibility of becoming diabetic. Although it's unclear why people of certain races, including black people, the Hispanics, American Indians, and the Asian Americans are at higher risk. Age plays a key role where the risk increases as people get older. This may be because people tend to exercise less, lose muscle mass, and gain weight as people age. I mean, as people become old. But type 2 diabetes is also increasing among children, adolescents, and even the younger, and even in the younger adults. On the other hand, coming to gestational diabetes, if if you develop gestational diabetes when you are pregnant, your risk of developing pre-diabetes and type 2 diabetes later increases. If you give birth to a baby weighing more than 9 pounds, you're also at the risk of becoming type 2 diabetic. Now coming to the polycystic ovarian syndrome. This is in case of women having polycystic ovarian syndrome. a common condition characterized by irregular menstrual periods and excess hair growth, along with obesity, increases the risk of diabetes. Hypertension, that is a blood pressure greater than 140 or 140 by 90 millimeters of mercury, is linked to have increased risk of diabetes. On the other hand, the abnormal cholesterol level, that is the triglycerol levels, if you have low levels of high density lipoprotein or good cholesterol, the so-called good cholesterol, your risk of type 2 diabetes is higher. Triglycerides, or another type of fat carried in the blood, people with high levels of triglycerides have an increased risk of type 2 diabetes. Yeah, now coming to risk factors of gestational diabetics. Any pregnant woman can develop gestational diabetes, but some women are at greater risks than the others. Risk factors of gestational diabetes are mentioned in the slide, where the women greater than age of 25 are at increased risk, and the risk increases if the woman is pre-diabetic and a precursor, which is a precursor of type 2 diabetes, or if a close family member such as a parent or a sibling has type 2 diabetes, the woman is also more prone to become type 2 diabetic. And if you're also at greater risk if you have a gestational diabetes during previous pregnancy. If you delivered a very large baby, or if you had an unexplained stillbirth. On the other hand, overweight during pregnancy also increases the risk. As I mentioned earlier, the Hispanic and the American Indians come under the circle of the race who are being more diabetic. Now, coming to complications, long-term complications of diabetes develop gradually. The longer you have diabetes and the less controlled, and the longer you have diabetes and the less controlled your blood sugar is, the higher the risk of complications. Eventually, diabetes complications may be disabling or even life-threatening. Possible complications include the cardiovascular diseases, neuropathy, nephropathy, retinopathy, and foot damage, skin conditions, hearing impairment, and to an extreme, some people are even affected by the Alzheimer's disease. Now, coming to the cardiovascular diseases, diabetes dramatically increases the risk of various cardiovascular problems, including the coronary artery diseases, which I have mentioned in the previous lectures, where the arteries supplying the heart are being occluded by the fat, or to be more precise, the low density lipoprotein. And along with the chest pain, heart attack, stroke, and narrowing of arteries, the so-called atherosclerosis. If you have diabetes, you are more likely to have heart disease. I mean, heart disease or a stroke. Stroke is nothing but the decreased supply of blood to the brain. On the other hand, coming to nerve damage, the so-called neuropathy, excess sugar can injure the walls of the tiny blood vessels and that nourish our nerves, especially in the legs. This can cause tingling, numbness, burning, or pain that usually begins at the tips of the toes or fingers and gradually spreads upward. If left untreated, you could lose all sense of feelings in the affected limbs. Damage to nerves related to digestion can cause problems with nausea, vomiting, diarrhea, and constipation. For men, it may lead to even erectile dysfunction. Now, coming to nephropathy, the kidney damage. The kidney contain millions of tiny blood vessels. Clusters, I mean, the clusters of, the kidneys contain millions of tiny blood vessel clusters that filters waste from our body. Diabetes can damage this delicate filtering system. Severe damage can lead to kidney failure or irreversible end stage kidney disease, which may require dialysis or a kidney transplant. Now, coming to something called as renal threshold. As as I mentioned earlier, as there is increased blood glucose level, that is the increased level of blood glucose. Here comes the concept of the tank and the water flow, where let's take an analogy like a tank, where there is an open tank and a huge pipe which is filling the tank, which has a area of cross section of 50 centimeter, and a small pipe of 5 centimeter area of cross section is draining water from the tank, that is in the bottom. If and the water which is flowing through these pipes are are completely filling these pipes with the concept of this Bernoulli's theorem, where the whole pipe is filled with, I mean, the flow of pipe is complete with water, and when there is a overflow due to the inability of the smaller pipe to drain the water, the obviously the water flows out of the tank, which is, I mean, through the walls of the tank. So now on the other hand, I mean, now what happens, the same concept plays here, where uh, the normal level is being reached and the increased blood glucose level, I mean, there is a great overflow of blood glucose across the maximum limit, something like a concept of shutter and a dam. Now coming to eye damage, retinopathy. Diabetes can damage the blood vessels of the retina, potentially leading to blindness. Diabetes also increases the risk of other serious vision conditions such as cataracts and glaucoma. And in case of food damage, nerve damage in the feet or poor blood flow to the feet increases the risk of various food complications. If left untreated, cuts and blisters can develop serious infections, which often heal poorly. These infections may ultimately require toe, foot, or leg amputation. That is nothing but cutting of the foot, leg, or toe. Now, coming to skin condition, diabetes may leave you more susceptible to skin problems, including bacterial and fungal infections. On the other hand, depression symptoms are common in people with type 1 and type 2 diabetes mellitus. Depression can affect the diabetes management. Now, coming to the complications of the gestational diabetes. Most women who have gestational diabetes deliver healthy babies. However, untreated or uncontrolled blood sugar levels can cause problems for the baby and for the mother too. Now, coming to the complications that can occur in the baby as a result of gestational diabetes. Extra glucose can cross the placenta, which trigger the baby's pancreas to make extra insulin. This can cause the baby to grow too large. That is also called as macrosomia. Very large babies are more likely to require a C-section, that is the cesarean section, during the delivery of the baby. Now, coming to the low blood sugar, sometimes babies of mothers with gestational diabetes develop low blood sugar, that is hypoglycemia, shortly after the birth, because of their own insulin production is high. Prompt feelings and sometimes an intravenous glucose solution can return the baby's blood sugar level to normal. Now, coming to type 2 diabetes in later life. Babies of mothers who have gestational diabetes have higher risk of developing obesity and type 2 diabetes in later life. If untreated, gestational diabetes can result in baby's death or either before or shortly after birth. Now, coming to complications in the mother, which results due to the gestational diabetes. The condition called as preeclampsia is characterized by high blood pressure, excess protein in the urine, and swelling in the legs and feet. Preeclampsia can lead to serious or even life-threatening complications for both mother and the baby. Now, coming to subsequent gestational diabetes. Once the mother has had gestational diabetes in one of the pregnancies, she is more likely to have it again with the next pregnancy. So she's more likely to develop diabetes, typically type 2 diabetes, as she gets older. Now coming to the complications of, now coming to, on the other hand, pre-diabetes can also develop into type 2 diabetes if left untreated. Now coming to prevention, type 1 diabetes can't be prevented. However, the same health lifestyle choices that help pre-diabetes, type 2 diabetes and gestational diabetes can also help prevent them. Eating healthy foods, perhaps choosing foods with which are lower in fat and calories and higher in fiber, focusing more on fruits, vegetable and whole grains. Strive for variety to prevent boredom. On the other hand, becoming more physically active with the aim of 30 minutes of moderate physical activity a day, taking a brisk daily walk, riding the bike, swimming laps. Uh, if you can't fit in a long workout, break it up into smaller sessions spread throughout the day. Now, coming to losing of excess pounds. If you're overweight, losing even 7% of your body weight can reduce the risk of diabetes. Don't try to reduce weight during pregnancy. However, to keep the weight in a healthy range, focus on permanent changes of the eating habits and the exercise habits. Now, coming to what really diabetes need, the so-called management. As I mentioned earlier, diabetes needs a good diet and a healthier exercise along with the oral hypoglycemic therapy or the insulin therapy. Diet is the basic part of management in every case. Treatment cannot be effective unless adequate attention is given to ensuring appropriate nutrition. Dietary treatment should aim at ensuring weight control, providing nutritional requirements, allowing good glycemic control with blood glucose levels as close to normal as possible, correcting any associated blood lipid abnormalities to play a key role. On the other hand, dietary fat should provide 25 to 35% of total intake of calories, but saturated fat intake should not exceed 10% of total energy. Cholesterol consumption should be restricted and limited to 300 milligrams or less a day. Protein intake can range between 10 to 15%, where the total energy requirement increases for children and during pregnancy. Protein should be derived from both animal and vegetable sources. On the other hand, the carbohydrates provide 50 to 60% of total caloric content of the diet. Carbohydrates should be complex and high in fiber. Excessive salt intake is to be avoided. It should be particularly restricted in people with hypertension and those with nephropathy. As I mentioned, the inability of the kidneys to maintain the glucose levels, and due to the threshold, due to the excess glucose in the circulation than the renal threshold, the blood is being excreted in the urine, which is also called as glycosuria. Now, coming to the exercise part, physical activity promotes weight reduction and improves insulin sensitivity, thus it lowers the blood glucose levels. Together with dietary treatment, a program of regular physical activities and exercise should be considered for each person. Such a program must be tailored to individual health status and fitness. On the other hand, now coming to something called as now coming to end of the talk, diabetes is nothing but, it's not a disease, it's just a condition where the body is either not able to take up the glucose due to the insufficiency of the insulin, or due to genetic variability or a genetic disorder where the cell receptors of the cells are not able to recognize the insulin, where the concept of lock and key plays here. Yeah, now the take home message is, maintaining a good diet along with the proper maintaining of the good workouts is gonna make us, the concept of prevention is better than cure plays a role here, where weight control, blood pressure control, and reduced smoking and glycemic control along with the lifestyle modifications is gonna make us get away from the so-called diabetes. Thank you. With the doubts, please. Thank you, sir. Good evening, Mr. Rajkumar. He has asked, what is the purpose of insulin? As I mentioned earlier, insulin is a transporter which opens the door of a cell in order to put the glucose outside the cell, inside the, that is outside in the sense, in the circulation into the cell for further metabolism of glucose. Thank you. Happy evening, Miss Ramalakshmi. If a husband is a diabetic, is there any chance of wife getting it? Not at all. Only if it's something like a concept, like the concept of Mendelian transmission. I mean, Mendelian inheritance. Yeah, Mendelian inheritance, where there is a there is more possibility of only the offsprings becoming diabetic, and not the wife or the husband becoming diabetic if one among them is diabetic. Yeah, thank you. Happy evening, Ms. Gopika Karnan. Some people, even after taking sugar tablets and good diet, won't be able to control blood sugar level. What possible step can be further taken? Yeah, Ms. Gopika. Actually, as I mentioned earlier, diet along with the medications both go hand into hand. And most of the people nowadays, they tend to take oral hypoglycemic medications other instead of taking direct insulin, where insulin can be injected both intravenously and subcutaneously. Intravenously is nothing but directly injecting into our veins, the blood vessels which is carrying deoxygenated blood. On the other hand, the subcutaneous one, where the intravenous insulin injection is the reaction is very faster in comparison with the subcutaneous one, as most of the people do not follow a proper diet along with the exercise. They are not able to get the hypoglycemic level under control. Thank you. Yeah, happy evening, Ms. Lavanya. What is the difference between diabetic mellitus and diabetic insipidus? Yeah, Ms. Lavanya. First of all, as I mentioned earlier, diabetes mellitus is more dependent on the insulin. I mean, either the pancreas is not able to secrete insulin, or the cells are not able to take up the glucose as they lose the reception for the insulin intake. Where, as I mentioned earlier, the lock and key concept, where the insulin takes up the glucose from the circulation and puts it into the cell. Now, coming to the concept of what is diabetes insipidus. Diabetes insipidus is nothing but it is an hormonal imbalance. It is it is very different from diabetes mellitus. It is actually it is an imbalance of body fluids. This imbalance makes us feel to be more simple and more precise. It makes us feel thirsty, uh, and it leads to production of large amounts of urine. That's it. Yeah, good evening, Mr. Tagore. Why are amputation procedures performed on certain diabetes individuals? Yeah, Mr. Tagore.
Jaisuriya, you're not audible. It seems we lost Jaisuriya online. So kindly stay connected, people. We'll get again back on the connection. Jaisuriya, is it audible? Jaisuriya? Probably we couldn't hear you. No. Your it shows that you are connected, but we couldn't hear you. Possibly.
Yeah, sir, am I audible right now, sir?
Yes, yes.
Yeah, thank you. Sorry for the inconvenience, guys. Yeah, yeah, Miss Harivish Chudar, as I was talking about why grandpas and grandmas didn't have were not diabetic earlier. This diseases, I mean, this diabetic, the so-called disease, uh, was first of all called as the disease of the richest. I mean, to be in more simple terms, only the rich people were more diabetic, and the poor lot, I mean, not the poor lot, to be more precise, the farmers and the other people who were not living a sedentary lifestyle were not at all diabetic. Uh, a huge lot was not diabetic in consideration with the others who are living a sedentary lifestyle, where their diet had a high fiber content, and they didn't have uh, any other agents that could cause the damage of their pancreas. Yeah, Thank you, Ms. Hari Chuda. Yeah, is there any possibility to recover without medication? As I mentioned earlier, in case of type 2 diabetes mellitus, that is prior to type 2 diabetes mellitus, there is a stage called as pre-diabetes, as I shown and talked about that in the slide, in the presentation, where if proper diet and proper exercise is given along with the diet, something like more fibers, to be more precise, and uh, for your convenience, something like the millets, the foxtail millets, the split gram, thinai karupu ulundu in Tamil, that's what we call it, right? uh, the millets and the pulses and other low glycemic index foods were eaten in the older days, and if we follow the same food style along with the proper exercise that I mentioned earlier, that could make us not becoming diabetic. Thank you. Yeah, Miss Gopika, can chronic pancreatitis cause diabetes? For sure. It's not that chronic. Actually, in case of pancreatitis, there we can replace it by we can replace the pancreas by doing a pancreatic surgery, where this could be. I mean, actually, the patient will become diabetic as there would be damage of the pancreas, where the insulin secretion has become reduced uh, than the optimum level in order to help the uptake of glucose into the cells. So ultimately, what could be done? Replacing surgery could do, which can improve or reduce the glucose levels in the bloodstream and could be taken up into the cells. Thank you. Yeah, Miss Hari Shurer, nowadays even farmers and other hardworking people also get affected by this disease. Why? That's obviously due to actually, as I mentioned earlier, the cause of diabetes is unknown. Where our researchers have come to an extent where these could be the causes. The damage to the pancreatic beta cells which secrete the insulin. On the other hand, the mutation in the gene which could cause the less uptake of glucose from the bloodstream into the cells, where there is a huge drawback between there's a huge gap between why this lot of people is uh, even this lot of people is people are being affected by the state called diabetes. But on earlier, the as per the American Diabetes Association, the people becoming diabetic, the normal levels were quite higher. As due to the adverse lifestyle modification as days passed on, uh, the levels has come down, where nowadays the 126 milligram per deciliter of glucose in the circulation is being considered as diabetic, that is pre-diabetic. Yeah, thank you. Yeah, Ms. Gopika, is insulin the only culprit hormone, or is there any study to ensure other sources or other hormone causing diabetic mellitus? Yeah, Ms. Gopika, on the other hand, there are other set of hormones that could cause the hyper, that could keep the blood sugar level high. That is the uh, cortisol, epinephrine, norepinephrine, and even the growth hormones. Those play a key role in keeping the blood sugar level higher. Thank you.
Any more questions, people?
Yeah, thank you, Ms. Tejasri. Yeah, Ms. Lavanya, is there any particular medications for DM? As I said earlier, insulin can be, whether first of all we'll have to classify whether it is type 1 or type 2. Thereafter, administrating insulin, uh, administrating the level of insulin can be considered in case of medications. On the other hand, the sulfuranyls, which help for the secretion of the insulin and keeping the blood level hypoglycemic, can be used along with on the other hand, it comes under the hand of the doctors, where they prescribe the metformin and other medications which keep the blood glucose level low, perhaps to be more precise, to a normal level. Yeah, Ms. Gopika, can there be cases that goes complicated due to delayed diagnosis? Yeah, Ms. Gopika, as I mentioned earlier, that could be causes of retinopathy, neuropathy, and neuropathy. That is damage to the eyes, damage to the kidneys, and damage to the nervous system. The whole set of the whole system which is controlling the body. Thank you.
Any more questions, people?
Yeah, Ms. Gopika, best food source to pick up to control diabetes mellitus. As I mentioned, the low glycemic index, the food with low glycemic index will slow the increase of blood sugar and fast, uh, the foods which I mentioned earlier, like the foxtail millets, on the other hand, something like other millets like ragi and kambu will do. To be more clear, the uh, the food with low glycemic index has to be taken. On the other hand, the fiber-rich foods has to be taken. Yeah, thank you.
Any more questions? Okay. So thank you so much, Jay Surya. I guess there are no more questions.
Yeah, thank you, sir. Thank you very much.
Yes. So thank you so much, people, for connecting with us, and that was a good session. So I have posted the feedback link here. The link will be active 12 midnight. You can just review us on the G page also. I've just given the link. We'll be hoping for more sessions from Jay Surya again. So stay connected with us for all the webinars. Kindly share it with your friends also. This particular session went live on YouTube also. So kindly share it with your friends. Probably they can be benefited by this also. Thank you so much once again, people. We'll meet you tomorrow evening 5 o'clock. Another one webinar live from UK. So see you tomorrow evening 5 o'clock. Bye. Good night.